Hello, and welcome to the Hour of History podcast. I'm Stephen Bauman, and it's great to be with you for another week. If you're new to the podcast, welcome. And if you're interested in hearing fantastic history from experts all around the world, listen to one of the 115 episodes that we have. You'll learn about revolutions, empires, cultures, arts, languages, environments, and medicines. One of the things I love about the Hour of History podcast is that we aren't stuck in the history department. Although there isn't anything wrong with the history department, it's fun to take a walk around campus and meet other experts as well. We've talked to folks who've written academic books in a number of fields, and medical history is one that requires respect for a lot of different areas. That's why I'm especially excited about today's episode. It brings the academy together. It brings our world together. It lets us walk across the virtual college campus for a day at least. And today I'm delighted to welcome a medical sociologist who's written a new book about acid. That's right. Her book is called Acid Revival, The Psychedelic Renaissance and the Quest for Medical Legitimacy. It was just recently published by the University of Minnesota Press, and it'll capture the interest of historians, scientists, and basically anyone who's interested in a pretty good story, a really good story about the history of medicine. So right now, Dr. Danielle Giffort will help us trace the rise, fall, and reemergence of psychedelic medicine through some really fascinating stories. Dr. Giffort, Danielle, welcome to the Hour of History.
Thank you, Stephen.
So I was really excited to get a copy of your book and to be able to page through this, I guess you could say, psychedelic topic. I'm sure you've never heard that joke before. But what brings an academic to this area of study?
Well, as a medical sociologist and someone who studies a field called science and technology studies, I've always been really interested in how knowledge is produced, and even more so in looking at absences of knowledge. So what's not there, what don't we know, and the ways in which that's actively produced as opposed to just an omission in knowledge. And so the case of psychedelic science seemed like this really great theoretical case to look at absences in science, because you have this field that in the mid-20th century was a huge area of study, that there were thousands of articles published in the basic sciences, in pharmacology, in psychiatry, in psychotherapy, looking at how LSD and other psychedelic drugs could be medicines and could help people with their various mental health problems. And then it just kind of goes away, and nothing really happens with it for decades, especially in the United States. And then in recent years, it comes back. And so I was really interested in looking at those ebbs and flows in knowledge production and how we can account for that absence, and how the researchers doing this work today grapple with that absence themselves. So it's a very academic-y answer, but my interest was that it was a really good theoretical case. Of course, it's also a very sexy topic, so to speak. It's fun. I really enjoyed, reading all the things that I was coming across about the topic, talking to the people who are doing this work, and then writing about it too, because, having read the book, I'm sure you saw how I took great advantage of the puns that are ripe in this field. So, that there was a theoretical interest, but also I just thought it was a really fun, interesting topic.
Yeah. And well, maybe we should step right into this issue that's in the field, and the topic is the levity in it. Is it a serious thing? Why don't people take it serious? Maybe that can introduce us to the history a little bit.
Well, yeah, why don't people take it seriously? Yeah, so the most common answer to that you'll hear about, why did this research go away? Why don't people think about psychedelics as potential medicines? Is that it's because of the 60s. And specifically that we had this growing countercultural movement that was using psychedelic drugs in ways that was very threatening to the so-called establishment. And that in response to that, we had this moral panic around the drug that was followed by really prohibitive legislation. This legislation made it difficult but not impossible to do this research. And so now we're still struggling with that historical event today. Okay. So that's kind of the common story that we hear about to explain why these drugs aren't considered medicines today. Now, there's been more recent work conducted by historians in the past decade or so that challenge that common narrative and that look at other factors that were happening to contribute to the decline in psychedelic research well before the hippies and before the moral panic and before all the laws happened. And so when I started talking to contemporary researchers, I was curious what they thought. Like, why do you think that your field died in the 60s? And a lot of them would repeat those same stories of, people, parents and, politicians freaked out about LSD and made it illegal. But what they always fell back on, like so consistently, was, it's really Timothy Leary. And so for those listeners who are less familiar, Timothy Leary was a clinical psychologist who was a lecturer at Harvard University in the early 1960s. And while he was at Harvard, he conducted a series of really controversial experiments with psilocybin, which is the psychoactive ingredient in magic mushrooms. This research garnered a lot of attention. It was seen as not very methodologically sophisticated and even kind of, he was even accused that he was sort of thumbing his nose at scientific standards of how you produce knowledge about drugs or anything really. And because of his different actions at Harvard and then after Harvard, when he became this countercultural guru and was advocating for everyone to use psychedelic drugs, that these actions of a researcher turned evangelist for psychedelics, that this in the minds of contemporary researchers really destroyed the field. And so, go ahead.
I was going to say, Timothy Leary certainly takes a central place in this story, in this book. And if listeners aren't familiar now, they will be by the end of the podcast and by the end of the book. One of the things you mentioned is that the classification of drugs, and you mentioned how he introduced, magic mushrooms or whatnot. It to the public in a way, it deals more, reveals more about the context than the drugs themselves. What was the context of Leary's world?
In terms of what was going on in science, or
why was there backlash against introducing a new drug into the field?
So for sort of the context of what was going on more broadly outside of Leary is that he wasn't, although he's one of the most famous psychedelic researchers, he wasn't the first person who was doing research with psilocybin or LSD. And it had already been a pretty active field for, 10 or so years before he even got involved. And even before he came into the psychedelic scene, there were already growing concerns about studying these drugs in terms of things like methodologically, how do you fit psychedelic drugs into randomized controlled methodologies where you have double-blind studies and randomized groups that they're placebo-controlled, because this was a model that science was moving towards around that time. Which wasn't the case, in the earlier part of the 20th century. But so now you have these sort of methodological problems and changes happening in the larger context that Leary and other researchers were practicing. And psychedelics didn't fit into that model. And so that produced a lot of concerns. There were also concerns that the drug had a potential for abuse, especially among the professionals who were using it. So initially, this drug was distributed by Sandoz Pharmaceuticals, where it was first synthesized in Switzerland in 1938. And they would distribute this drug to any interested investigators as long as they could have data back on what this drug does, because they didn't know. They were trying to find an application for it. So this meant that people, not just researchers, were requesting the drugs, but even psychologists who were in private practice. So they would request the drug and then they would charge patients, right? This drug that they got for free from Sandoz. And then they'd get the drug and they'd charge patients sometimes several $100s a pop to have this LSD or psilocybin therapy session. And some people, some medical professionals started to get concerned that there was going to be a high abuse potential in using the drug in this way, and that it was starting to trickle out of these professional settings of the scientific lab, out from the therapist's office and into just a general public, and that recreational use would increase and cause a lot of problems. And so this was the context in which Leary entered the psychedelic research scene. So in other words, all these things were already happening, and then he just kind of came along and exacerbated a lot of it.
Right. And I like how in the book you give us that whole picture of the emergence of LSD and this almost comical story of the Swiss scientists bicycling through the countryside and things like that. But it's not exactly something that it isn't something that you find in nature. This is manufactured. How does that play into the science aspect of it? LSD is synthetic, but there's other psychedelic drugs that are naturally occurring. So things like mescaline that are found in the peyote cactus, psilocybin that's found in psilocybin mushrooms. So I think what changed with LSD is that now we could synthesize this, like pharmaceutical companies could synthesize this drug more easily, and it could be more easily distributed so that people could test it to see if it was safe in a clinical setting. Because for thousands of years, indigenous cultures had already been using psychedelic drugs like peyote in healing and spiritual ceremonies. So the healing use of psychedelics is not new, but it became more amenable to clinical science when we had the synthesis of LSD and we were able to produce it in that way. So that was a significant event when Albert Hofmann synthesized it in 1938. And then a couple years later, he actually self-ingests and takes that bicycle trip that you were talking about, where he finds that it has all these psychoactive properties that do really interesting things. Yeah. And I think it's really cool as a historian to see already how we have a problem with what you mentioned at the beginning, the production of knowledge. So you have Hoffman discovering this when, in fact, you mentioned it has been used by native groups or at least types have been used by different groups, by indigenous peoples and so on, for a long history. Now, I can already see it getting really tangled too, because we have these strands of historical and spiritual use of psychedelics, and then it's entering to the stream of science. How does it end up in Leary's hands?
There is definitely a tension, both in the past and in current research, between scientific research of psychedelics for medicinal use on the one hand, and then indigenous use on the other. And there have been critiques leveled against past and current researchers about cultural appropriation of these medicines. Nonetheless, there are a lot of researchers today, and like Leary, who would try to take different perspectives on psychedelics from indigenous cultures into account. So a good example of that is the way that psychedelic therapy sessions would be structured. So that you'd have these preparatory sessions where, the shaman would try to explain, what these drugs do or effects that you might expect, although you can't totally predict it. And then having the drug session and having different props and tools in place to try to elicit a certain reaction through taking the drug. And usually the reaction that you hope to achieve, at least through psychedelic therapy, is having this, spiritual epiphany. So like you're really tripping, but you're doing it in a way that has healing properties. Like your ego shatters and you come to see yourself and your problems in a new way. through, working with the therapist or the shaman and the different props that are there. And that afterwards you have these integration sessions where you talk about what happened and you work through it. So these weren't things that clinicians and psychiatrists developed on their own. They took most of these tips from indigenous cultures. And so Leary did too. And so they do bring that in, but there's also questions about how much they're appropriating it. And so that's a continuing tension even today.
Very interesting. Yeah, I had on the podcast, I talked to Mike J., who did a study of mescaline, and he was more interested in kind of the indigenous history of the drug and how it was used in ceremony. Whereas your work really complements it nicely by looking at its I guess, kind of failed takeoffs into American mainstream thought. One of the things you mentioned just there, you said tripping. Do you think the vocabulary and the language around psychedelics is something that might be holding it back from the scientific community, or do we just lack vocabulary for these things?
I think that in terms of issues of legitimacy for the medical field and the scientists doing this work, it definitely can be a problem. So they tend to they don't usually use words like psychedelic drugs. They prefer to say like the actual scientific nomenclature for the name. And when I would talk to them and ask them about that, it all boiled down to legitimacy. Like, I'm not going to talk about ecstasy. I'm going to talk about MDMA, which technically are kind of different drugs anyways, because ecstasy can be cut with a bunch of different things, but its pure form is MDMA. But the point being that there's a lot of legitimacy in using that kind of scientific jargon. And so sometimes they run into issues when they're talking with journalists, right? So they talked to me, but they knew that I was an academic. And so they would discuss these things with me a little bit differently than I'll see them talk with reporters in the media. And one of the things that they would complain about a lot is how journalists would use that sort of language, like in headlines and in talking about the research, because for the researchers, it felt like it belittled it. Like, it's really good to sell papers or to get hits on your website, to have an article that's called like flashback, research with LSD is returning, right? That's really, really sexy and it's going to get viewers. But the researchers, they would struggle because they want people to know about this research and to accept it and to maybe eventually be consumers of it. But there's a fine line between getting that kind of mainstream acceptability while also maintaining scientific legitimacy, which is what they need if they want to get funding to do this research and have the institutional space to conduct it. So, it's another of the many tensions that they have in this field for sure.
Yeah. And one of the tensions that when I talk to historians and psychologists who do this sort of thing is psychology really wants to prove objectivity. And it seems like psychedelics like LSD just throw objectivity out the window because of how different they are. Is that one of the struggles?
Yeah, for sure. And I think that struggle is most evident in one of the major legitimacy crises that I discuss in the book is, whether or not these researchers have actually done psychedelic drugs themselves. And that is a great example of this tension in science between subjectivity and objectivity. Because if you've had this drug experience, then they can have all sorts of accusations thrown at them that they can't really speak objectively about this drug, that they no longer are disinterested researchers because they've done the drug, so they must have an agenda that they want to push forward. But on the other hand, the reason why self-experimentation has such a big history in psychedelic research is because it's based in this humanistic approach to psychology that if you're going to be treating someone with this psychoactive drug with very unique and very intense properties, that you can be a better researcher, a better therapist for your patient if you've gone through that experience yourself. So it's this tricky balancing act that they have to navigate, where the subjective aspects of the experience in their minds helps make them better researchers, better therapists, create a safer environment for their patients. But on the other hand, it might make them lose objectivity in the eyes of their scientific colleagues. So that, continuous tension in science, beyond psychedelics, between objectivity and subjectivity is a really big sticking point for a lot of researchers.
Yeah, and you can see just in that how a shaman type role, someone who's clearly experienced with doing this before, would lend credibility to a researcher or to a doctor. At the same time, would also subject them to some pretty terrible skepticism, maybe from people who aren't familiar. Can you talk a little bit about the methods that were set up in order to test these drugs? Because they're unique.
Yeah, so initially during the first wave of psychedelic research, and I'm specifically speaking towards research on psychedelic therapy, because there was psychedelics were used scientifically in a lot of different ways. So there was a strand of research, one of the earliest strands of research with drugs like LSD was to look at it as a madness mimicking substance. So in other words, it's a drug that mimics psychosis. So psychiatrists used to give these drugs to, quote unquote, normal, healthy subjects to see if they could understand the biochemistry of schizophrenia. There was another strand of research where you had pharmacologists using LSD to try to learn more about neurotransmitters. So the strand that I'm commenting on methodologically right now would be the therapeutic angle. And so initially, kind of like most areas of psychotherapy and psychiatry at the time, the methods looked a lot different than they look today. And part of that is related to, like you were mentioning earlier, the context, because the randomized controlled trial that we're so familiar with today in clinical trials was not solidified in the mid-20th century. So the methods from our perspective today seem kind of loosey-goosey and almost like pseudoscience, right? Like they just, bring a patient into a room, give them a drug and kind of see what happens. And I'm not saying that they were doing it so carelessly. In fact, they actually were very careful in how they set up these therapy sessions. And so the sessions for psychedelic therapy in particular were guided by this concept that Leary's usually credited with coining called set and setting. And so the idea with set and setting is that when you're ingesting a drug, especially a psychoactive drug like LSD, that it's not just, insert drug, have effect, like something like Viagra, like you take Viagra, it increases blood flow to the penis, right? You have this sort of automatic reaction. But psychedelic drugs don't work like that. They're very dependent on set. So, your psychological state of mind, how are you feeling? What do you know about the drug? What are your expectations and motivations for what's going to happen? And then also what's called setting. So that could be physical. So where's this happening? What's the location? But also cultural. So are you taking this in a place that has guidelines for these kinds of experiences, which a lot of indigenous cultures, did and do? Or are you taking it in a place where these substances are demonized and it's assumed that you're going to, quote unquote, go crazy if you take them? And so they would design these studies in ways that would facilitate a really optimal set and setting. So they'd bring patients into these rooms that looked like living rooms. They'd have couches, they'd have flowers on end tables, there'd be lamps instead of harsh fluorescent lights above them. They'd play music. So it was a very sort of chill atmosphere. And they would sit with these patients while they were taking the drug and having the experience. They were pretty hands-off when it came to psychedelic therapy. As the therapists, they would kind of let the patients go and let them go into the experience, but be there if they needed assistance. Okay.
And what sort of things were patients who were subjected to this or volunteering for this, what sort of things were they trying to help about themselves?
So as opposed to the revival, where the research is pretty focused on particular diagnoses, so especially things like anxiety in cancer patients, patients who have obsessive compulsive disorder. In the 50s and 60s, LSD and psilocybin were used for a wide range of different types of mental health problems. So they used to give LSD to kids with autism, which definitely isn't happening today, although there are some studies using MDMA for autistic adults. But one of the most prolific areas was for alcohol dependency in the 1950s. And so there was a lot of research that found that if they, structured the therapy session in that way that I was describing, that where they had optimal set and setting, and if the patient could undergo this, spiritual epiphany while they're on LSD, that it would help them look at themselves and their drinking behaviors in new ways that would contribute to them either not drinking or really decreasing the amount of drinking that they do after the session. So that was a really prolific area. But another area that I'm actually writing a paper on right now that they're not doing today is LSD is a kind of conversion therapy for gay men and some lesbians. So that was also not a super prolific area, but I came across quite a few papers about that, which also demonstrates the ways in which the context has changed, right? Homosexuality, which is a really pathologizing, medicalizing term, that's not considered a disorder today. So it's not surprising that they're not doing research on it. But at the time, it was. And so was frigidness in women, that women who can't, orgasm through vaginal penetration alone, that there are cases where they were given cocktails of LSD and Ritalin to see if it would help treat their frigidness. Okay. And that's not happening today.
Yeah. You can see where this becomes an issue with testing and reproducing results and so on. Wow. There's a lot there. I was shocked, first of all, the results of some of these alcohol cases from the 50s, alcoholism. I was shocked about that. So maybe, and then a follow-up to that question is, as a researcher, do the trails just die? And then some are resurrected, like you said, and now with issues that are still around, and some, the research just stops.
Yeah. I was shocked too when I saw those results. And so were a lot of medical professionals who did not do this type of therapy. And they weren't just shocked, they were really suspicious because the success rates for LSD therapy, especially for alcohol dependency, were pretty astounding and impressive. And so this is around the time where you start seeing these methodological critiques emerge against psychedelic therapy, because we have this push towards controlled methodologies happening at the time in science. And so all these scientists who aren't involved in LSD therapy are like, hey, wait a minute. Like, what's your placebo? Do you have a control group? Like, how are you randomizing this? And, most of these researchers weren't doing any of that because in their minds, you can't subject psychedelics to that kind of method. It just isn't going to work. There were some groups who did try and had a little bit of success, but overall it was sort of a failed project at the time to fit psychedelics in that type of methodology. And so you had these non-psychedelic researchers come in and say, hey, we're going to try to replicate your study, but we're going to use randomized controlled methodologies. And when they did that, they did not have the same astounding success rates. And so there was one study, for example, where they restrained participants while they were on acid, which, whether, you've done LSD or not, I'm sure you can imagine that that's not going to be a very good experience. Even if you're not on acid, if you're just in a hospital room in a study, strapped to a bed for many hours, right, you're probably going to have a bad time and it's going to be more stressful than therapeutic. And so not surprisingly, that study found or concluded that LSD was not a good way to treat alcohol dependency. And there were a lot of similar studies that came out concluding the same thing. Not all of them restrained their patients, but they were still finding like, hey, when we use these placebos or when we do this and that, when we subject it to good quote unquote science, this isn't working. And so that became a problem in the field. And then to sort of get at your second question of why do some strands of this research die and why do some emerge? I think it goes back to, the way that medical knowledge is produced, especially around diagnoses, right? So what counts as a medical illness? And at the time, things like homosexuality, hysteria was still, something that they were treating people for at the time. These things aren't considered valid medical diagnoses anymore. So in that sense, it's not surprising that we don't see those things happening in the revival. But it's also not surprising that we see this medicine or these drugs being used to treat alcohol dependency and anxiety in cancer patients, which are things that they were used for in the 50s and 60s, because those are disorders and problems that still persist today and that we still don't really have great treatments for. And so I think once again, they're trying to offer up some kind of viable treatment method for these illnesses that have been proven very difficult to solve.
Yeah. And like any gap in historical or scientific literature, when there's a few decades off, things really change and words and terms become outdated and it's hard to catch up. And if it ever does, a lot of times it doesn't. One of the things you mentioned a few minutes ago now that I'm still kind of thinking about, and that does take a prominent place in this history, is spirituality. And that's kind of unique. Well, maybe not so unique in the history of medicine, but why is spirituality always there, lurking in the background and sometimes in the foreground of this?
Because I think that's the goal, whether it's explicit or not. Like, the goal of these therapy sessions is that people recognize that there's more to the universe than just themselves, that maybe even they are a part of it, that they have something to contribute, that they don't have to be so inward focused or focused on the self, or, even challenging the concept of the self in general. So it sort of is woven through the whole psychedelic experience, at least how indigenous cultures have conceptualized it, as well as researchers today. And that does, like you said, create a sticking point for the researchers because, science and spirituality aren't supposed to go together, right? I'm not saying that as a fact, but I'm saying it as like that's sort of the discourse out there, that these are separate and distinct realms, right? They're mutually exclusive, and any attempts to merge them has often been met with resistance, because science is supposed to produce really tangible results, right? Like you can see it, you can feel it, but spirituality doesn't necessarily lend itself to that or to the scientific method. And so that's another area where researchers have to struggle, because they're trying to bring in these conversations about things like God, or that their patients are seeing God and now, they feel better, and their anxiety about their cancer went away because they met God while they were tripping, right? And so it's hard to have those conversations. I've talked to some psychiatrists doing this research, and they'd say, my colleagues would just like run away from me screaming if they heard me saying what some of my patients are telling me. And so it becomes really hard for them to integrate those conversations. And so in one of the chapters in my book, I talk about how the researchers today are trying to manage that struggle by bringing in neuroscience and quantifying these experiences so they can at least in some way fit with the scientific model, right? So I can show you an image of a tripping brain, and I can say, and I can sort of explain spirituality or whatever we want to call spirituality in that way, or I can create checklists, and I can operationalize things like mystical experiences. And then I can put numbers to it. And numbers have a lot of currency in science. Science is very quantified. So they try to bring in spirituality in that way. But it does still seem like they struggle to do it. And even as they'll publish papers that have titles like, mystical experiences or psilocybin-induced mystical experiences, help reduce, anxiety in cancer patients, even as that's the title of their paper, most of the rest of the article that you're going to read is going to be very focused on, here's the checklist that we used, here's the placebo that we picked and the control group that was in place. So they try to, as best as they can, interweave those conversations about spirituality in a scientific discourse, but it's very tricky to do that.
It's funny. It's almost like we've lost our language for it. One of my fields is American religion, and you see the Protestant Christian religions for sure push away from mysticism, almost all of them, almost uniformly. So any sort of mystical experience will be disregarded. There are certain branches, obviously, that favor that, but it's kind of interesting to see in this, scientists tend to gravitate towards Eastern religions. Do you find, well, maybe you can comment on that, but I also have a question here. Do you find that in the revival, that's still a phenomenon? Are modern scientists who are studying this also kind of gravitating towards Eastern religions?
Yeah, or any non-Western religion. So there are some of the, like, I guess you could call them like the fathers of the psychedelic Renaissance. So psychiatrists like Charlie Grob, who've actually studied indigenous use of ayahuasca, and have published scientific papers looking at, so these people who use this in a ritualistic setting. They'll tabulate sort of, here are the ways that it's helped these people, and also providing evidence that it doesn't really seem to lead to abuse within that particular cultural context. And so, Charlie Grob has published these papers in mainstream scientific journals and has even used some of that knowledge that he's gained to inform how psychedelic therapy sessions are run as well. And he's published papers on that. So I think a lot of these researchers do have an interest in, indigenous religions and cultural traditions surrounding psychedelics. And again, it's kind of their approach is if we can, filter this through a scientific discourse, maybe it will have more credibility to my colleagues. But I don't think they all necessarily want to do that. I think they would like to just talk about it in indigenous terms. But if they want scientists and politicians to, buy into this therapy, they have to speak about it in a certain way.
Yeah. And I think the listeners to this and the readers of your book are going to pick up that this is really a translation act that's happening, a translation from experience to scientific language and things like that, where we don't necessarily have the words or the concepts. And kind of this is what scientists and historians, sociologists do anyway, is put words to these stories, but it's interesting how that happens. And I thought it was interesting in your book how I found it to be one of the more readable academic books that I've read in a long time. You're making it in language that is comfortable for people, and I think that's a huge step in the right direction. And hopefully people will appreciate that. I was going to ask you, though, one of the things of your book is that you talk to a lot of people and you have a lot of stories. I wonder if you had one particular story that stuck out in your mind, or maybe one of these revival scientists who a conversation you found particularly meaningful.
I had a lot of the researchers who would off the record tell me in great detail about some of their psychedelic experiences that they had, and how those experiences were really the impetus for them doing the work that they do today, because it sparked in them this curiosity about how the brain works. And so then they wanted to become neuroscientists, or after having their own psychedelic experience, they thought that it could be very therapeutic for others. So then they wanted to become a psychologist. And so I think hearing some of those stories and those life histories in terms of how these researchers came to the field through psychedelics were very fun to listen to. But also it was very fun, or it was very interesting, because they'd be like, all right, but don't put the specifics of that in the book, and I don't, beyond saying that, clearly a lot of these people have had these experiences, and they struggle to speak publicly about them. I also liked hearing a lot of people talk about Roland Griffiths, who's one of the most prominent, well-known psychiatrists doing research in the revival. And he's at Johns Hopkins, which is also it's like the hub for psychedelic research, at least in the United States. And almost all of them would ask me, hey, do you know if Roland has done psychedelics? I'm just like, dude, I don't know. But the reason why they wanted to know is because to them, he's the anti-Leary, and that's what they're all trying to emulate today. And so they'd have all these questions about him, and, they just assumed that I've talked to everyone in the field, because like you said, I talked to a lot of people, and there's not a ton of researchers doing this. So they would want to know, what did this other person say? Or, and I'd be like, sorry, it's confidential, because that's, sociologists and other, social scientists who do this kind of research, we're bound to confidentiality, but they were very curious about that. So that kind of made me laugh whenever it would come up.
Yeah, in a way, it puts pressure on you as the link between, all these. Because one thing people don't understand about researchers is we really don't get to talk to colleagues all that often, especially when we're not meeting for conferences and things like that, especially off the record too.
Right.
So yeah, that's very interesting. Well, I'm curious too about this idea that these might be, or a drug that might be discovered, or a drug that exists might hold a key to behavioral change, because it seems like so many people are after that, whether it's workout gurus or spiritual gurus. Everyone's trying to change, and a lot of people thought, or still think, that these might be the key to a change. Did you find that to be true?
I found that the researchers I spoke with are very cautious in the way that they speak about their work. I think because of some of the claims that earlier researchers would make, which would be like, hey, this is like a magic bullet medicine, and it's gonna, cure people's problems and make, us better people, and maybe even change the world, right? So those sort of grandiose claims, a lot of researchers today want to stay away from. So I'd hear some researchers tell me that they hoped that drugs like LSD or psilocybin could be psychiatry's antibiotic, right? So this medicine that has the potential to treat a wide range of problems and effectively and quickly. But they were also very careful, and they didn't really necessarily want to speak in those terms, which I think is probably a good thing. And a lot of them wanted to say, or would say, we need to have more research. Although I don't know how much more research they're going to need to put out, because most of it that has come out has been pretty positive, that the way that they're constructing these sessions is usually very effective for treating, whatever diagnosis they're studying.
Mm-hmm. And now we've spent most of the discussion talking about the scientists, but a large portion of your book too, you deal with how the law changes in legislation. Do you see this revival being hampered by our legislators?
Well, yeah, I think so. And I guess I said that in a sassy way. I didn't necessarily mean it to sound so judgy, but yes. And I think part of the dilemma is, since 1970, most psychedelic drugs, some people sometimes will group ketamine as a psychedelic drug. It's more of a dissociative, but it's not Schedule 1, I believe. But most psychedelic drugs are Schedule 1, which means that they're seen as drugs with high potential for abuse, that they're not safe even in a medical setting, and that they have no accepted medical use. Okay. So this makes it really hard to get these studies done. You have to go through a whole bunch of different agencies to get approval, like the Drug Enforcement Administration. So that makes it very tricky, but the point being that it is possible. So just because something is a Schedule 1 drug doesn't mean that you can't study it, but it does put up a lot of roadblocks for getting this research done. And there have been some researchers who've written commentaries in scientific journals charging, the United States government. There's also been researchers in the UK charging the governments there for hindering innovative research on these substances because of these restrictive drug laws that not only make it difficult to get approval for these studies, but make it really hard to get funding, because most of the funding sources that these researchers are getting are not, from the government. So the government's not really funding this. They have to go through different private organizations and private funders. And they've been pretty successful, but that can only get them so much money. So the drug laws do pose problems. And just even in addition to that, because of these drug laws and because of the discourses that we have about illicit substances, I think sort of the automatic knee-jerk reaction to hearing about this type of research is like, oh my God, that's a bad drug. And especially if we're talking about research on like alcohol dependency, it's like, oh my God, you're using another drug to treat a drug addiction, so, which I get, right? It can be hard to wrap your head around that, especially if you grew up in an environment where you were taught that like, these are bad drugs, they're going to make you go crazy and insane. And, there's certainly risks to taking psychedelic drugs in any context, whether it's medical or not. But those PSAs from the 80s, they don't help matters. So I do think that the field of drug legislation has made it difficult for them to do this research.
Yeah, it'll be really interesting to see how that continues or changes, especially as you mentioned in the books. A lot of people grew up in the Nancy Reagan dare just say no era. Mm-hmm. And a lot of those people are on their way to becoming legislators. So I don't know, who knows if it's caused more polarization or what, or maybe it's caused the reverse effect. How do you find your work received? What do students say, and what have people who've read your work say to you?
Most people are very fascinated by it. I think there's been more visible conversations about psychedelic drug research happening in recent years, but there's a lot people still don't know about it. So people have a lot of questions about, what kind of research is being conducted, how is it being done. A lot of people like to make jokes about how, especially older people who I interact with, they make jokes about how like, oh, well, I grew up in the 60s, so like I know all about that, sort of like, wink, wink, I've, passed the acid test. So, most of and that's a big difference between me studying psychedelics as a sociologist versus, these MDs and neuroscientists and psychopharmacologists studying it, because there's less of a legitimacy issue for me, because I'm not administering the drugs or to patients or anything like that. I'm studying the people who do that. So I think because of that makes people question my motives less. I don't get as many questions about, my own personal use, whereas the researchers get that all the time. So I think because of my disciplinary status, I don't get the same negativity that some of the researchers do who are actually conducting the clinical trials.
Yeah, and in a way, sociology really sets you up nicely for that. Sociologists, though, are typically, not always, but often more concerned with the present. Do you find this book launching you more into the future? Because you deal quite a bit with medical history in it.
Yeah, I mean, I think the crux of the book is how is the haunting presence of the past in this particular field, because there's all these old crises in psychedelic therapy that sort of laid dormant for a while while nothing was happening essentially for quite a few years. And now that we have this revival happening, they're all coming back. And so these researchers are struggling to confront the past. And, as I argue, probably ad nauseum through the book, that they do it through Timothy Leary. Like Leary is this conduit, or really the fall guy, for all of these legitimacy crises that this field is experiencing. So this story of the past, it becomes a problem of individuals who are misbehaving, especially Timothy Leary, as opposed to problems from the past and in the present that have to do with structure and culture. So things like legislation, both in terms of how we regulate drug research and how we regulate drugs more broadly. So I think the book, while it leans historical in spots, the point is to sort of talk about how the past makes an impression on people in the present, and how people in the present are rewriting the past, or maybe not even rewriting it, but they're telling a particular story about the past to try to make sense of what they're going to do today. And they're not even doing it dishonestly, right? So they tell the story that Leary ruined psychedelic science and how they're still picking up the pieces because of him. And they're not telling it in a way where they're not telling the truth. Like, for a lot of them, this is what they think happened. And so I'm not concerned with what was the ultimate truth of what happened. So I don't think Leary killed it. And honestly, I don't think most of the researchers do either. But they construct the story and then they act on the basis of it. So if Timothy Leary ruined psychedelic science because he was talking about how he used psychedelic drugs and it ruined his objectivity, he wasn't using randomized controlled methodologies, he was encouraging public consumption of drugs, he was trying to bring spirituality into science, right? So if we just don't do those things as researchers today, everything will be fine. And so they structure their actions today through that story. But at the same time, another big conclusion of the book is they still kind of are like Leary in a lot of ways.
Yeah. And then I think you really captured it with that phrase that I wish I had thought of, haunting presence of the past. And it seems like we're certainly dealing with that in everything. And that's something historians recognize and talk about, that studying the past often tells you more about the time it was written than the past itself. And unfortunately, we're getting towards the hour here, but that means it's time for our suggestions. Okay. And I'll put you on the spot a little bit and let you go first. What would you like to suggest to the listeners of the Hour of History podcast?
Okay, so this is going to be so ridiculous, and maybe if people take the suggestion, watch it, they won't want to buy my book because they'll think I'm nuts. But there's this hilarious YouTube series. It's this talk show called Right Now with John Goblikon. And John Goblikon is the mascot for a band called Necrogoblikon. And I'd like to add, I never even listened to this band, Necrogoblikon. I think they describe themselves as comedy rock, and all their songs are about goblins. This is why I said people might think I'm nuts. Yeah. But it's a really funny show. So that they have this mascot character who's dressed like a goblin and takes on that persona, and he's just very silly, and he interviews other musicians and personalities, and it's very, very funny to me. So if listeners want, they can watch it and then let me know what they think.
That's nice. That's a good, a refreshing suggestion. A nice break from the seriousness. that makes me feel like my suggestion pales in comparison, but my suggestion is a much more morose, and you mention it in the book, and actually it creates a bad stereotype for doctors, but I like the book. It's The Strange Case of Dr. Jekyll and Mr. Hyde, and by Robert Louis Stevenson, in which a doctor experiments on himself for reasons of passion and science. And it's a short, tiny little novel that I think will give people the escapism they need these days to be sent back to Victorian times. It might not be as entertaining as the goblins, but
depends on your sense of humor. Yeah.
Yeah, exactly. Depends on your sense of humor. So excellent. Before we sign off, is there anything about the book that maybe we missed, or something you want to just? Doesn't have to be about anything.
So it's like the Seinfeld conclusion of my book. It doesn't have to be about anything. I guess I'd say one thing that's an interesting area that I didn't get to explore in the book, that I know there's some cultural anthropologists studying this, is that even when the medical above ground research was dormant for a while in the 70s and 80s, there was still, and continues to be today, an underground network of therapists who practice psychedelic therapy. And so it's a very interesting group of people. And Michael Pollan wrote about it a lot in his book, in which he totally scooped me. But, if you've read his book, he interacts with some of the people doing this work. But if you're interested in more academic studies on it, there's also going to be work coming out about that. So I just wanted to mention that. In some ways, revival is a misnomer, because this never totally went away. And there were still, therapists who were committed to offering this type of treatment for patients.
Yeah, that's interesting. And it seems like as long as it works, or at least has a chance of working, these kind of things don't go away, whether you legislate against them or whatnot. Thank you so much for joining us. The book is called Acid Revival, the Psychedelic Renaissance and the Quest for Medical Legitimacy, and published by University of Minnesota Press, but readable for all audiences. And there's links to that on thehourofhistory.com. It's been a pleasure talking to you, Dr. Danielle Giffort.
Yes, thank you, Stephen.
Well, thank you all for listening to the Hour of History podcast. I hope you'll check out the book. You can always get show notes and more information at hourofhistory.com. On the Hour of History, it's our world, anytime, any place. So long.